And you are going to see that I am with my friend and my colleague. This is Nurse Bethany. And Nurse Bethany, it looks like we have some pretty neat and interesting and fun tools of the trade that nurses might use in their everyday work. Can you tell us what we have here?
Yeah, so a lot of times when people see this stuff, they think that's maybe just doctors. They see it on TV and the doctors are just using them. But here in the nursing program, we're going to train nurses to do it because nurses use these. The nurses are the eyes and the ears for the doctors. So it's really on the nurse to make sure that they're getting a good assessment on their patients and they're reporting that to the physician. So as a nurse, you play a really important role in the healthcare system. So in the sim lab, the first thing I tell students when they come in here is that they have to treat this patient just like it's a real patient, or treat this mannequin just like it's a real patient. They're going to treat this environment just like it's a real hospital, so we're going to use real tools. Our mannequins are high fidelity, which means that they have a lot of features that are just like a real person.
Yes.
They blink, as you can probably see right now.
I think I saw that.
Yeah, they have little holes up here where they can sweat and cry. Their mouth can turn blue if they're not receiving enough oxygen. I don't know if you can pick up on it on the camera, but his chest rises and falls just like he was breathing like a real person. Another cool feature that we have with the mannequins is that the students can come over and assess him by listening to his heartbeat. He has a heartbeat, he has respiration sounds, I can give him all kinds of different lung sounds. He has bowel sounds that they can use that stethoscope for. So they'll do it just like a real nurse and a real patient.
So students are getting a very practical, very hands-on experience in the healthcare programs here at VHCC.
Absolutely. This is, as Dr. Wright had mentioned, this is a big part of their education here and time that they get to spend here in the sim lab, as well as in the clinical setting where they're getting to go into the actual hospital.
It's like a real hospital here.
It is. Another really fun feature with their mannequins that makes it just that more lifelike is that they can use their pin lights or their otoscopes, their ophthalmoscopes to be able to do assessments on the patients. You can shine a light into the patient's eyes, and I'm not sure that it'll pick up on your camera, but their pupils will actually constrict when the lights shine in their lights, just like a real person.
Let's get a little closer.
And they'll dilate.
Yeah, I see that. I hope it comes through on the video. I see that. It's incredible.
So if the nursing students actually pick up on any issues, one of the big things we tell them to do is go call the doctor, just like they would in real life. So they're getting this real life experience. And the best part is if they miss something or they make a mistake in here, it's not going to hurt the mannequin, but it's definitely a good learning opportunity for them so they won't make those same mistakes in real life. We don't just have this guy, we've actually got a baby as well. So Dr. Wright mentioned there's a lot of different fields in nursing, and OB is my specialty, so that's where I enjoy the most, but I'm a little partial to this baby because I really like all of his features. And he's just like that big guy over in the bed. He can breathe. You'll see his chest rising and falling. His little arms move. He can cry. Let's see here. Let me make him cry for you. So if you give him a shot, he's going to cry. Or if you make him cold or uncomfortable. And then I think this is Tracy's favorite part here. We have the little neonatal stethoscopes here.
Look how tiny. And then if we compare it, is there a larger one that we can compare it to?
I have the one I just used on the big guy.
They're so tiny, you can probably tell by the way that Nurse Bethany holds it in her hand how little it is, but that's just kind of a comparison. And so just all kinds of things and technology available to prepare students for that real world experience that they're going to need. This is incredible, Nurse Bethany.
Absolutely. And we try to take care of patients, and we give students lots of opportunities to take care of patients across the lifespan. So we have a birthing mannequin in here who actually delivers a baby. And then another one of my favorites is our pediatric mannequin.
Yes.
And we're going to do a little quick activity with him. So Tracy, if you want to go in there and talk to Jerome.
And so this is a lot of fun. Nurse Bethany and I've been learning so much myself about the nursing simulation lab, but this is one of our pretend patients, and and spending time over here, I've been learning how important it is just communication with the patient. So we're going to do something a little fun just to show you how the mannequins operate. And this is my friend, and he's not feeling well. So can you tell me what your name is?
Jerome Jones.
Jerome Jones. And Jerome, how old are you? 8 years old, Jerome Jones, and he is...
I don't feel good.
You don't feel good? Can you tell me, does something hurt, Jerome?
My belly hurts.
And Jerome is telling us that his belly hurts. Jerome, do you think you might be sick? Do you think you need to throw up?
Yes.
Oh, goodness. So, oh, no. So Jerome's not feeling well. And so, guys, if you're watching this, I think we need Nurse Bethany. I think we need to call on Nurse Bethany to come out and help us to get Jerome here, our patient, feeling just a little bit better. And there she comes.
Jerome, I hear you're not feeling well. I'm going to go ahead and give you some medications here that'll make your stomach feel a little bit better, okay? I'm going to check your armband, make sure you're who you say you are. You're Jerome Jones. Your birthday is August 31st. So I'm going to get you some medicine here, and hopefully we can make you feel a little bit better, okay? Nurse Tracy seems to be doing a great job with you today.
We're going to get you feeling better, Jerome. Nurse Bethany's teaching me some things.
Yeah, I'm going to put it through your IV, so we don't even have to give you any kind of sticks. We're just going to give it right through your IV. Okay, Jerome. Let Nurse Tracy know if you need anything else.
So, Jerome, I hope that's going to help you to feel a little bit better. You should feel that medication start to working soon, and that should ease some of the tummy troubles that you're having. Is there anything else that we can do for you, Jerome?
Can I watch TV?
Can you watch TV? Absolutely. I think we can get the TV going. What kinds of television shows do you enjoy watching, Jerome?
Sometimes I watch TV all day.
Oh.
And I like SpongeBob.
SpongeBob SquarePants. Well, let's see if we can get...
You know the song? SpongeBob SquarePants. SpongeBob SquarePants. He lives in a pineapple under the sea. SpongeBob SquarePants. SpongeBob SquarePants.
There we go. So, Nurse Bethany, we've got Jerome singing now. I think it's safe to say that Jerome is feeling a little bit better. What do you
I think you did a great job. Yeah, he seems like he's doing much better now.
So, guys, hopefully that'll show you the type of experience, a little bit of the experience that you can expect to receive as a student here at Virginia Highlands Community College in the VHCC Nursing Sim Lab.
Absolutely.
So, Nurse Bethany, what do we want to show everyone now? There's so many fun things
Yeah,
here.
we've got so much here. I guess I can show you what are some ways that we make it realistic for the students in here. So
Yes.
we try to make it as realistic as possible, because remember, I tell them you've got to treat these mannequins just like they're real people. So the way that we do that is by a lot of different props or by moulage. The one that Tracy's showing you right now is one that we use for bleeds and blood clots on patients. It's actually just cherry jello.
Okay, because this looks so real.
Yes. Now, I don't know. Can you guess what that might?
I don't think I want to guess what that is. I'll let you go ahead and tell us.
Yeah. That's patients have bowel movements, so we have to have our students take care of things like that too. And it's actually just some cocoa powder, Vaseline, and black cherry jello too. Yeah. So it smells delicious.
So you all mix it up and make it.
Yes, we do. Yep, absolutely. And
That's
then
incredible.
here, of course, is some urine.
I think we know what that is.
Yeah, just clear liquid with some yellow food coloring, and then there's some different kind of urine. Of course, if you compared the two, which would you be concerned about?
I'm going to be concerned about this one. This does not look normal.
No, it's absolutely not. That would be somebody who's definitely having some kidney failure and kidney injury. And then over here is one of my favorite things that we're actually getting ready to start the simulation with our second-year students. It's a burn patient that we'll have, and I'll actually have these burns all over the mannequin's body, and the students have to assess the degree and the depth of the burns and treat that patient. It's
just incredible. It's just such a I don't know, a hands-on learning experience for students, and I could see how if someone came to Virginia Highlands Community College, I guess how much more confident that they're going to feel going out into the career field, going out into a healthcare setting after spending time here in the nursing simulation
Well,
lab.
that's the goal. We want to make sure that you are absolutely ready to take your boards, and then you're absolutely ready to step out onto the floors of the
Wonderful.
hospitals.
It's wonderful. Anything else that you have to show us today, Nurse Bethany?
I think that's about all.
Okay.
I appreciate your time, and we're really looking forward to getting more nurses in here and we definitely need more nurses out in the workforce, especially during this time. But I think we're good, Tracy.
Okay, so we're going to go over here, and I'm actually, I meant to do this at the beginning, but in full disclosure, I did not have her on record, so I might have to ask her to come and do it again. But I am here today. This is my friend and my colleague. This is Dr. Beth Wright. She is the Dean of Nursing here at Virginia Highlands Community College, and she did a wonderful job a few minutes ago doing an introduction and welcoming you all to the Nursing Simulation Lab and inviting you to be students at Virginia Highlands Community College. I had a major failure and I did not hit the record button. So we're going to do this again because I want you all to hear from Dr. Wright. Dr. Wright, tell us a little bit about nursing. What are 3 things that you think, if there's a person out there and they think they might want to do nursing as a career, what do you say to those people today?
Well, welcome, students. We're so glad to be able to offer this to you, and you've seen our wonderful simulation lab. That's one of my favorite types of learning for our students because we can create any kind of situation in here that we necessarily don't do in the clinical setting. We can't do in the clinical setting, like in the hospitals where we do our clinicals. So this is an awesome place to get some learning done. But 3 things, Tracy. First of all, taking care of patients and serving patients. That is such a rewarding field. I've been a nurse for a real long time, been around patients all of my life. I love it because, you get such a reward when you help individuals. So that's a number 1 thing. Second would be job placement, 100% job placement.
It's wonderful.
The employers, the hospitals, different healthcare settings come to us wanting our graduates.
Yeah.
And, I've had many hospitals say, I could put every one of your graduates to work.
Yes.
So job placement is definitely not a problem, okay? And then the third thing is the different fields of nursing that you can get into. So, you can take care of the babies, as you saw with our simulation mannequin, babies, Jerome, that size, pediatric patients, adults, and our older adults. You can also get into all kinds of different fields like emergency room, if you like that action, critical care, medical surgical, in the OR, in the operating room, taking care of individuals who are having children. So there's just so many different fields. If you're interested in like taking care of patients with cancer or with terminal illnesses, just all kinds of different fields to get in there into. And I know we mentioned this before. Both male and females. This is no longer just a female profession. It's also male. Males are definitely welcome. We have many male students, and we're glad to have that. I wanted to mention too that here at Highlands, we have the practical nursing program and the nurse, the registered nurse program. So when you finish our programs, you're eligible to sit and take the licensure exam for those and become an LPN or an RN. We also have our nurse aid program here if that is of interest to individuals too. So welcome, and we would love for you to be a part of Virginia Highlands Community College nursing program.
That's incredible. Thank you so much, Dr. Wright. And I just think about, nursing, there's something for everyone. So you could have a new career in 2 years, or even less, even in as little as maybe 9 months with their practical nursing program, or maybe even less than a semester with nurse aid. So, so many incredible opportunities here at Virginia Highlands Community College. Dr. Wright, thank you for inviting us over to spend some time and hang out in your nursing simulation lab today.
Welcome.
And I have one more colleague and friend with me today. I want to introduce you all. This is Pat Farmer, and Pat is our coordinator of dual enrollment. She is a former school counselor. She has spent many years in high schools working with students and helping them to transition to whatever comes after high school. So Pat, we know that dual enrollment is an incredible opportunity for high school students. They can really get ahead. Families can save big, and they can still get an incredible education with dual enrollment. So tell us 3 things today that you think students watching this may want to know about dual enrollment.
Well, Tracy, you asked me about 3 things, and I could not limit myself to 3 things.
You keep
I will
going.
be honest with you, I could not do it. The number 1 thing is what you've already touched on, and that it is extremely affordable while you're in high school. In many cases, our school systems have been so supportive that in one school district, you don't even pay anything if you take a dual enrollment class. The others, you pay a nominal fee of $7 a semester hour, which is huge. So affordability is certainly the key point that I would want to make. The second thing I would like to suggest is that by taking dual enrollment in high school, you have a chance to try out classes.
Yes.
Such as our nursing program. We will talk about what classes you could take in high school that would prepare you for the nursing program, but talking about being a nurse and then actually taking the courses are 2 entirely different things. And you may take a course and decide, oops, this is not for me.
Yeah.
But you could also maybe see something else that you hadn't thought about that you would think, oh,
That's
wow,
right.
I hadn't even thought about that
That's right.
career. So that would be another option. The third would be the fact that you are taking college level courses while still in high school. So you not only have that support system of your high school teachers, you've got that support system of family, you're still at home, you've got all of those factors to enter in to give you that added support
Yes.
that you won't necessarily have when you get into the college setting.
Yes.
And then the 4th thing that I would suggest is that the dual enrollment classes strengthen your high school transcript. It makes you more marketable for whatever schools you decide that you may want to go to upon graduation from high school. It could potentially save you time and save you a ton of money because you're already earning college credit while you're still in high school.
Yeah. That's wonderful, Pat. And so I know that dual enrollment, if you want to be a nursing student at Virginia Highlands Community College, dual enrollment can be for you. But if maybe you do want to go into another major or another career path, or maybe you're undecided, and that's okay, dual enrollment could still be for you. But for those students today that are watching, and maybe they are certain in their career path, they know that they want to become a nurse. I understand that here at Virginia Highlands Community College, we have prerequisite courses that students would need to take before they start the nursing program. Pat, can students take those courses as dual enrollment while they're still in high school?
Oh, absolutely. And by taking them in high school, you're setting yourself up to be more prepared, but you're also eliminating the need for one entire semester
Yes.
of the nursing program by taking these classes while in high school.
Yeah.
I have a cheat sheet I'm going to tell you that I do, because as soon as I start doing this, I always forget one.
That's okay.
So one of the classes is the dual enrollment English.
Yes.
All of our high schools have access to dual enrollment English, whether that be in-house, where they have a teacher inside their school that teaches it, or through an online opportunity. Anatomy and physiology is another class that you can take through Linwood Holton Governor School as a dual enrollment class. This is an amazing class. The instructor is phenomenal. The other good thing about this particular class is that if you are a student that's working for the Advanced Studies Diploma, this science will count towards your Advanced Studies Diploma also while you're in high school. The SDV class, or the Student Orientation class, that is a class that Virginia Highlands Community College offers every high school in the fall of each year. This costs the students nothing to take this class. It is all virtual and it's independent of your high school schedule. So you need to talk to your school counselor about this class and your career coaches.
Yes.
They will be advertising when that class is available, but it will be every fall in every school that we serve.
Yes.
And it does not cost the student anything at this point. But again, if the career coaches and your school counselor are the key people there. Another class is ITE 119, or I think 115 now. Every high school has access to this class, either in-house or virtually. So we are excited about that particular class as well. And then the final one is developmental psychology. Elite Learning teaches this class, and this is a class that is well received, and kids really, really, really like it. If you decide that you don't want to go into nursing, this class will also work for other careers as well.
Yes,
So
yes.
these 5 classes are all obtainable while you're in high school, and they just really strengthen the
Yes,
transcript a
yes.
tremendous amount.
Yes, and so students, step 1, dual enrollment, go talk with your school counselor. Would that be the recommendation, Pat?
Absolutely, and
Great.
for other career advice and about the nursing program at Virginia Highlands, your career coaches are a tremendous asset as well.
That's great, that's great. All right, so thank you, Pat. Thank you, Dr. Wright. And we just want to thank everyone for taking the chance. I'm going to turn my camera around to be with us today as we've toured the nursing simulation lab. We certainly would be honored to have each of you as students here at Virginia Highlands Community College. And we'd love to talk with you more about what Virginia Highlands Community College has to offer. To do that, all you've got to do is go to our website. You can visit vhcc.edu/enroll now, and you can schedule your appointment to speak with someone by Zoom, telephone, chat, and we want you to know that as your community college, we are here for you. So thank you for joining us today. Stay well, stay safe. Goodbye.